Hey, good morning, everybody. This is Chris Moore, your System COO and CNO for St. Vincent's Health System. I want to give you a quick operational update and then highlight a team that we have here with us today. So today is Thursday, April 23rd. It's day 44 of our incident command for COVID-19, and just some quick operational stats to help you reconnect. So right now for the state of Alabama, we have just over 5,600 total cases, and what we've seen change here in the past several days is the doubling rate for Jefferson County continues to lengthen, which is a good thing. And right now, we're no longer in Jefferson County leading the state with the highest number of cases. Right now, Jefferson County is at 754, but Mobile County has actually surpassed Jefferson. Their doubling rate, the amount of time it takes for their number of cases to double was much higher, as we talked about last week, and it has since overtaken Jefferson with 776 total cases. You'll see those two counties are way ahead of number 3 is Lee County that has only 330. So if you look, obviously, the highly populated areas, things like that, definitely are showing the larger number of cases. But what the state's really looking at, and what Governor Ivey talked about the other day with the state health officer, is the number of new cases per day. And that's the metric that's really being focused on about, whether certain restrictions will be loosened up. When will they allow elective surgeries to open back up again? And right now they're watching that really close. There was some excitement last week when 4 out of 5 days there was a decline in new cases per day, and 4 out of the 5 actually had less than 200 cases per day. But right now it's been tempered, because over the last 5 days, 3 of those 5 days, we've had more than 230 new cases per day. So we're not hitting that continued decline. So just from a trending perspective, I think the message is really, we're not there yet, seeing that continued decline in new cases per day. For our community, specifically here in St. Vincent's Health System, today we have about 15 positive cases currently within our health system. That's going anywhere from 13 to 20 per day. And cumulatively, we've admitted 65 COVID positive patients since this started. Over the past several weeks. We have had 16 deaths, but we've also already discharged 41 of those 65. So a lot to be said for that. I think we had 3 discharges yesterday. So a lot of progress is being made. So really my message is, this is a marathon. It's definitely not a sprint. For the next several weeks, we should expect COVID to be part of our operations. So you're seeing a lot of preparation right now around reopening surgery, a little bit more for those urgent cases, and just preparation for when those restrictions do get loosened around elective cases. So a lot's going on with that. Definitely want to keep you engaged and all that, but for now I want to highlight the team that we have with us. So this is our MedExcel team. These are our facility guys that really make it happen and keep you safe every single day, and I think their role has never been more important than it's been since we really started this journey. So I want each one of you to kind of introduce yourself, and then we'll go through some things that y'all have done throughout this pandemic to help keep us all safe. So you want to start, Michael?
Yes, sir. I'm Michael White. I'm the facilities manager here at St. Vincent's, Birmingham.
I'm Jeff Roberts. I'm the facility manager at St. Vincent's 119.
Terry Patterson. I'm the facility manager at St. Vincent's, Chilton.
Steve Seeley, facility manager at St. Vincent's East.
Chris Barnes, area facility director for all of St. Vincent's health system.
Got it. So obviously, I think we're missing one right now, but we had trouble fitting everybody in the room anyway. And so if you really look at it, a lot was done when this first started. It was a sprint, if there's ever been a sprint. And luckily, you guys stayed prepared, for things like that. But Chris, you want to explain what all y'all did initially?
Well, initially we had to do a detailed assessment of all of our equipment and plan, and work with the clinicians on what the tier planning was going to be, where the surge planning was going to be at, and decide how many negative pressure rooms we're going to need, and see how many we can actually create. And we was able to create over 40 negative pressure rooms, flip a lot of areas, over 60 different areas, rooms over to positive airflow, to ensure that we were putting our clinicians in safe environments, making sure things were going very well. And one of the biggest things that I think we were able to do is opening up some ORs that we can treat COVID or infectious type patients in, and not just making those ORs in a way that they were negative pressure or positive pressure, but maintain the existing environment by creating the anti-rooms and really making a national impact. The systems that we created were able to share with Ascension as a whole and now being used as a national standard. So that was some of the things we did in the beginning.
Absolutely. So I know we spent time every single day, several hours a day, and even on the weekends and nights, kind of going through these different plans and leaning into y'all's expertise. So ton of negative pressure rooms, the OR work, like you said, the expertise of these guys literally led to that same work being replicated in hospitals across all of Ascension. So definitely leading the way, and really appreciate that. From an ongoing perspective, y'all want to kind of share how you're ensuring that we keep people safe every day?
Yes, sir. Every day, all of our facilities, we check all of our negative pressure rooms. We check to make sure everything's good. We get with the nursing staff as soon as we check them, let them know that all their rooms are negative, that they're safe to use, and we educate all the nursing staff on any questions they might have about any situation that might come up with their rooms.
Got it. I know that's important. I mean, there's a lot of emotion in this and fear, and seeing those kind of things every day is a big deal. And I know, that's not all y'all are doing. Y'all could list probably for an hour everything else you're doing, but highlight a couple of other things maybe that the associates of our health system might not yet know.
Just general support of each facility and trying to support the state itself in setting up COVID testing sites at different locations, to set up, tear down, and adding signage throughout facilities so people know which way to go, where to be. That's one thing we do as far as support.
Yeah. So like you all, your regular job didn't stop when COVID hit, and neither did theirs, right? We still have the ongoing maintenance, all those kind of things every single day, the PM checks, everything. But then this on top of it, has been quite the effort. So, on behalf of the health system, definitely want to just say thank you for all that you're doing. The preparedness that you had going into this led to us being ready and all of our associates being kept safe. So really appreciate all y'all are doing.
Thank you.
Thank you.
Thank you.